basically to advise and support the police officers on shift, and also we provide help and support for general members of the public that come into our attention through different logs, through a variety of whatever logs may come in. So we might have an illness log come in, or you know, a sudden death, or a concern for safety, or a missing person. Those logs it's brought to our attention, and then we're able to have a look, see whether there's any mental health element to that log. If there is, then we can look through our notes, and we use a Rio system, which is an AWP system. So we're able to look through the notes and see whether they're open to service, or see whether they've been open previously, and looking at their risk history, and you know, looking at different pieces like that. Like, so we've put an advice on the log, that's relayed to the police officer. So, for example, if you've got someone that's feeling suicidal, we can look at that risk. We can actually speak to the police officer regarding what that risk looks like, and we can also speak to the person on scene, to the general public, and give them advice on either signposting, or we could potentially write to their GP and inform their GP of what's happened, so they, you know, advise appointments. We can refer to other services, so, you know, often there's other Rethink or Mind services out there that we can refer to. So basically supporting that person with, you know, that mental experience that they're having at that moment. So if that person's actually open to that service, what we will do is get hold of that team to be able to support, so that team will go out, they'll know about what's happened currently with that person, and be able to go out and deal with that accordingly. So otherwise, you know, there's a lot of voluntary service out there, so there's lots of Mind and Rethink services that we can refer to. There's also primary care liaison. And as I say, you know, if that person is going through crisis and things like this, so say like they might be using drugs or alcohol as a coping mechanism, we can refer, you know, we can suggest going to Turning Point and other sort of different sort of services that are open out there, really. Quite a lot of logs that have a mental health element to them. It doesn't mean that someone's mentally ill. So, you know, it could be a well-being thing. It could be an experiences that people are having at that time. You know, they could have a relationship split, or, you know, and it could be experiencing sort of their well-being. We're fairly busy, so about per shift, I'd say it's about 8 or 9 logs that we're sort of dealing with. That's not all mental illness, so there's mental well-being sort of elements to that too.